Hi guys, it's Dr. Nasser here. Today we're talking about a very important topic, and that is how to clearly distinguish between endocrine glands from exocrine glands. It might seem simple, but it is a concept that if you don't understand it, could really trip you up in exams, especially in histology, physiology, pathology, etc. Now, if you understand the route of secretion and how substances reach their target, you'll never confuse these two again. Now, let's start with the big idea. All glands make a product. The key difference is, where does that product go? In endocrine glands, they release their products directly into the bloodstream. Now if you look at this diagram here, notice there is no duct. The secretory cells sit close to the capillaries and their product diffuses straight into the bloodstream. These glands produce hormones. Hormones act as distinct target organs, often far away from where they're made. Classic examples include the thyroid, adrenal glands, the pituitary glands. Now let's compare that to exocrine glands. Here, notice the presence of a duct system. The gland produces a secretion, and the secretion is delivered through a duct to a surface. Now that surface might be the skin, or it might be a lumen of an organ, like the oral cavity or the GI tract. Exocrine secretions include enzymes, mucus, saliva, sweat, and sebum. Examples include salivary glands, sweat glands, and the exocrine pancreas. Now, if we visually compare these side by side, on this side we got endocrine, which have no duct, they secrete hormones right into the bloodstream, so it's got bloodstream transport, and it has distant effects. But on this side, we got exocrine, which has a duct present, has non-hormonal secretions, has local delivery, and it acts exactly where it's produced. Now, this contrast is far more important than memorizing examples from a textbook. So it's very simple. Here's what you must remember. No duct equals endocrine glands. Duct present means exocrine glands. Endocrine signals via the blood. Exocrine secretions act locally. Now notice, the pancreas actually does both. It has endocrine via the insulin and glucagon, and exocrine via the digestive enzymes. That last point is a very common exam favorite. So in summary, endocrine glands communicate using hormones and the bloodstream. Exocrine glands deliver their product through ducts to a surface. When in doubt, always ask, is there a duct and where is the secretion glowing? Once this distinction is clear, histology slides and gland-related questions become much easier. I hope that was useful. If you liked that video, press like and subscribe, and let's go to the next video.